All right, well, hey, Dr. Hagmeyer here, and in today's video, I want to talk to you about 5 very commonly prescribed medications that they cause gastrointestinal motility issues, and how that slowdown of these medications can really set the stage for SIBo and dysbiosis and leaky gut and just inflammation throughout the body. Now, this is a really important topic to me because many patients continue to struggle with bloating and IBS and reflux and excessive food intolerances, and they don't realize that in some cases, the root cause started when they began taking this medication months or even years ago. Now, as always, this video is for educational purposes, and so any advice really should never take the place of your prescribing doctor, all right? With that disclosure, let's jump into this. So if you've been diagnosed with IBS, SIBo, SIFO, fungal overgrowth, candida, inflammation, stay tuned because today's video could be a very important piece of the puzzle. Most people don't realize that the gut just isn't a tube, it's a muscle, and like any muscle, it's deeply dependent upon nerve signals to move and propel food throughout the system. This movement is called the migrating motor complex, or the MMC. When the MMC slows down, the small intestinal environment becomes stagnant, and that's when bacteria, good and bad, start to overgrow where they shouldn't, and that's what we call SIBo. So with that foundation, let's jump into the 5 most common medications and categories of medications that slow down GI transit and can impact your MMC. So the first medication I think about are medications that affect GABA levels. These are going to be things like gabapentin and Proton. These are often prescribed for nerve pain, neuropathy, seizures, and of course fibromyalgia. Gabapentin affects the nerve system, but the gut has its own nerve system called the enteric nerve system. And research shows us that gabapentin, Proton, and other medications can affect GABA levels, and that in turn will slow down intestinal transit. It'll cause bloating, reflux, and nausea. Now, I've seen this happen many times with patients who develop SIBo shortly after starting gabapentin or anti-anxiety medications, and it's often overlooked as a contributing factor. Okay, so number 2 on my list is actually antidepressants. 1 in 8 women are on some type of antidepressant. Sometimes it's an SSRI, sometimes it's an SNRI or a tricyclic antidepressant. Here again, the issue with antidepressants is your gut has its own nerve system. And so when you take medications that affect your neurotransmitters, you're going to affect the nerves and the motility of the GI tract. Let's talk about SSRIs for just a moment. These again affect your serotonin levels, and 90% of serotonin made in your body is made in your gut. Tricyclic antidepressants and anticholinergic medications, they significantly slow down gut motility. They block acetylcholine, which again is a neurotransmitter that's crucial for parasympathetic and overall gut motility. Tricyclic antidepressants are sometimes prescribed to purposefully slow down diarrhea in IBS patients. So we know that they impact motility. But when motility slows down, food sits longer, bacteria ferments, and gas builds up. That leads to dysbiosis. The third medication I think about are oral contraceptives. Birth control increases progesterone levels, which has, again, a relaxing effect on smooth muscle in your gut. Higher progesterone levels equals slower transit time. Now, on top of that, your sex hormones influence your microbiome. So again, the bacteria living in your gut, they influence bile production. They help you break down fat. They regulate and part of the immune system in the gut. In fact, several studies actually have shown that oral contraceptive use, birth control pills, for example, is associated with higher risks of inflammatory bowel conditions and alterations in that microbial balance. So we're talking about Crohn's disease here. All right, number 4 on my list when it comes to slowing down motility, setting the stage for SIBo, are your GLP-1 agonists. Again, these are all the craze right now. These are drugs like Ozempic and Wegovy, Mounjaro. These medications have really exploded in popularity for diabetes and weight loss, but they dramatically delay gastric emptying. And this is one of the ways they create fullness and reduce your appetite. The problem is that delayed gastric emptying can progress downstream into the small intestines, and that leads to gastroparesis, constipation, bloating, heartburn, nausea. And again, more clinicians are now reporting SIBo and methane-dominant overgrowth in those patients that are using these GLP-1 drugs due to the effect that they have on motility. All right, the last category that I want to talk to you, number 5, is really opioids, right? This is an important one because, again, opioids are notorious for causing constipation because, again, they reduce peristaltic activity. They increase water absorption. They slow down transit time. And again, this is so common that there's even a name for it. It's called opioid-induced bowel dysfunction. So again, think about it like this. Stagnant stool and food equals fermentation, gas, and microbial overgrowth. And that becomes the breeding grounds for dysbiosis. So let me give you my 60-second step-by-step explanation of how slowed motility actually causes dysbiosis and how it causes SIBo. And this will make sense to a lot of you. Gut movement slows down due to these medications' influence on neurotransmitters like serotonin, GABA, and acetylcholine. Food sits in the small intestine too long. Bacteria ferment that food. As bacteria ferment that food, gas and toxins build up. Microbial imbalances begin to shift towards this dysbiotic state, and the immune system now reacts. Remember that your small intestine is supposed to have very low bacterial counts. So when bacteria begin to overgrow, the whole system is thrown off. So again, why this is so important is it now increases intestinal permeability. And again, this is that leaky gut that we can't take lightly. Leaky gut has been linked in a wide research of articles and conditions showing autoimmune diseases like Hashimoto's, type 1 diabetes, psoriasis, rheumatoid arthritis, all kinds of metabolic disorders and food sensitivities and symptoms like brain fog and anxiety and skin conditions. Now, I'm not saying leaky gut causes all of these conditions in every single person, but the research and literature is very clear in showing that intestinal permeability and chronic inflammation travel together. All right, so here's the big takeaway and what I want you to really take away from today's video. Number one is if you've been struggling with digestive symptoms or autoimmune problems or chronic inflammation and you're taking one of these medications, it may be worth exploring whether motility and dysbiosis caused by these medications are part of your problem. If you visit my website, you can find more information on leaky gut and gut health. You can also download a free ebook that I put together. And so if you found this video helpful, if you found this information helpful, here's another video that I think will be super interesting to you as well. You can either watch it over in this corner here, or I'll post it over here as well. Take care, and we'll see you in the next video.